Hello, welcome to A World Without Malaria. You may be wondering why we've included the subject of HIV/AIDS in this series about malaria. Well, it's simple. When people have both HIV/AIDS and malaria, the complications of malaria are more likely and more severe, and this is particularly true for pregnant women. It's important to recognize and treat the patient for both diseases as soon as possible. HIV/AIDS requires specialist medical care, but being aware of it will greatly affect how you go about helping people with malaria. As always, I recommend that you refer to your A World Without Malaria manual and you watch this presentation with a pen and you take some notes. Turn to Chapter 16, Malaria and HIV/AIDS. Enjoy.
Hi, my name is Ellen, and I'm going to talk with you about HIV/AIDS, or to give you the full title, Human Immunodeficiency Virus and Acquired Immunodeficiency Syndrome. HIV/AIDS was first identified in 1981. And since then, many millions of people have died from HIV-related causes. According to the World Health Organization, in 2022, there were approximately 39 million people across the globe living with HIV. And thankfully, this infection number is decreasing slightly each year, since its height in 1995. In everyday language, the terms HIV and AIDS are often interchanged. However, HIV is actually the name for the virus, and AIDS is technically the name used for end-stage infection. HIV is a virus that infects the immune system. For a little more information about the immune system, see the appendix section of your workbook. But to describe it in brief, the immune system is a network of cells, tissues and organs that work together to protect the body from disease. Now, when the HIV virus enters the body, it infects the white cells of the immune system. It gradually damages and destroys their ability to fight any disease or infection. And if not recognized and treated, the virus continues to get stronger until 10 to 50 years later, AIDS develops and the person is seriously ill. The HIV virus is transferred through contact with contaminated body fluids, such as blood or serous fluid, which is the clear to pale yellow watery fluid that is found in the body. HIV can even be transferred in vomit and diarrhea. There are many ways the virus can be transferred, but sexual contact is the most common way. The virus is passed in the seminal and vaginal fluids. So it goes without saying that the more people a person has sexual intercourse with, the more likely they are statistically to get HIV/AIDS. Also, a pregnant woman with HIV can pass the virus to the baby during childbirth or through her breast milk. And needles that are contaminated with HIV will infect whoever uses them. This includes tattoo artist needles, drug addict needles, and even shaving blades. Obviously, the possibility for spreading infection also extends to all contaminated medical equipment that is not properly sterilized before reuse. HIV-contaminated blood used in a transfusion can also spread the disease. Blood needs to be properly treated and tested prior to use so that it does not spread the disease. I just want to pause here for a moment and look at the issue of an infected HIV mother and breastfeeding. The World Health Organization says that the HIV mother should consider the different options for feeding her child and make the best choice for her and the baby. One option is to bottle feed the baby with the recommended infant formula. However, the expense for formula can be high, and in some places availability is also an issue. The risk of the baby becoming sick because of inadequate sterilization of the bottles and the availability of clean water also needs to be considered before deciding to use formula. Another option is that the mother takes the correct HIV/AIDS medication and continues to breastfeed. She could also express her breast milk and then heat treat the milk, which kills the HIV virus. After this, she can bottle feed the baby with the treated milk. Of course, this needs to be done to the strictest procedure. In some places, there are breast milk banks where breast milk has been donated and pasteurized so it can be used by anyone who needs it. Finally, another option is that mothers who do not have HIV can breastfeed the baby on behalf of the HIV mother. It is important that HIV/AIDS is diagnosed as soon as possible so that treatment can be started quickly and serious illnesses prevented. Diagnosis of HIV/AIDS is done clinically or by using one of a variety of HIV/AIDS self-test kits. These methods enable a rapid diagnosis, but should always be confirmed by a qualified health worker using a test kit that has been approved by the World Health Organization. The World Health Organization also says that no single test can provide a full HIV-positive diagnosis and should be repeated prior to treatment. Most tests measure the level of HIV antibodies in the blood, which are produced in the first month following exposure, as the body tries to fight off this disease. If the blood test is done very quickly following exposure to HIV/AIDS, the body will not have had the time to produce lots of antibodies, so false negatives may occur. However, whilst it is better to wait 1 month after possible infection in order to get an accurate result, if someone has had a high-risk exposure to the HIV virus, such as a needle stick, or they have had sex with an HIV-positive person, testing may be done sooner. It is important to counsel people before and after a test for HIV, because the implications are enormous and a positive result will affect every aspect of their lives. Their relationships, family, finances, career, and all future prospects will be impacted by this positive result. People who have HIV will develop signs and symptoms. However, in the beginning, these may be mild and easily missed. 50% of people will notice an acute viral illness 2 to 3 weeks after infection. That can last anytime between 3 to 21 days. This could include such things as feeling unwell, a fever, sore throat, loss of appetite, swollen lymph glands, headaches, diarrhea, nausea, and they may have a rash over their body. The person will recover from this and will have a period of asymptomatic HIV, which means they will not display outward signs of infection because the immune system is fighting off the HIV virus cells and the person remains well. This can be for any length of time, even up to 10 to 15 years. However, during this time, the HIV virus continues to multiply and the symptoms will become more obvious until the person begins to develop AIDS. A person with AIDS will have, amongst other issues, such things as significant weight loss, diarrhea for more than a month, fever for more than a month, swollen lymph nodes, extreme tiredness, and fungal infections such as thrush and dark patches of skin. HIV/AIDS can be divided into 4 stages. The first stage is asymptomatic, and there are no symptoms. The second stage is mild, and at this stage there is some weight loss, minor skin lesions, and frequent respiratory tract infections. Then the third stage is advanced, and at this stage there is significant weight loss, chronic unexplained diarrhea, fever, severe bacterial infection, and unexplained anemia. And finally, there is the severe stage, and this is also known as HIV wasting syndrome. The person develops chronic severe infections, heart problems, and their health deteriorates even more and will lead to death. Let's look briefly at the management and treatment of HIV/AIDS. The human body can't get rid of HIV, and no effective HIV cure exists. So once a person has HIV, they have it for life. Luckily, however, effective treatment with HIV medicine is now available. If taken as prescribed, this medicine can reduce the amount of HIV in the blood to a very low level. People with HIV who take the HIV medicine as prescribed can live long and healthy lives and will not spread the virus to other people. If they fail to take the medication correctly, perhaps because the drug treatment is too expensive for them, or the drugs are not available in the area, or they simply don't follow the schedule as instructed, their illness will progress to AIDS. Pregnant women with HIV, even when they have no symptoms, need to be treated as it may prevent their child from getting infected with HIV. People with HIV/AIDS will get many different types of infections, which will need to be treated with the appropriate medication such as antibiotics. If someone has had a high-risk exposure to HIV in the last 72 hours, as in the case of a needle stick injury or rape situation from an HIV/AIDS person, it is possible to have immediate treatment for 1 month. This has an element of preventing HIV developing and is known as PEP, post-exposure prevention. Prevention of HIV/AIDS is important, and one of the most effective ways to prevent this terrible disease is to restrict sexual activity to one faithful partner. Couples who only have sex with one another and are not carrying the HIV virus will not develop HIV/AIDS. Using a condom when having sexual intercourse will help to stop the HIV virus from transferring from one infected person to another, because the condom forms a barrier that the virus can't penetrate. The HIV virus can live outside the body for 7 days in dried blood, so it's never worth the risk of sharing needles or being careless when handling any blood-contaminated products, such as malaria rapid diagnostic test strips. Other diseases can also be spread by sharing medical equipment. When handling any body fluids from another person, gloves should always be worn, because it may be that the person has the HIV virus. And if there is a small break in the carrier's skin, say on their hands, the HIV virus may get into their bloodstream. This is one of the reasons we emphasize wearing gloves when doing hemoglobin or malaria rapid diagnostic test. Hand washing with soap is always a good practice before and after dealing with the patient in order to prevent the spread of any diseases. In a hospital, it is essential that any medical equipment that is being reused is properly sterilized, so the HIV virus is destroyed. Many pieces of medical equipment, such as needles, should only be used once and then destroyed. And it goes without saying that all blood used for transfusion needs to be treated properly before use so that any HIV virus is destroyed. Please be kind to people with HIV/AIDS. It is not got through normal contact with people like playing and eating together. HIV is not spread by toilet seats, mosquitoes, or other insects. It is not spread by sharing cups, food, or water. Many people with HIV/AIDS are simply unfortunate victims of life circumstances, and it is important not to judge and condemn them. They need compassion and love as they deal with this horrible disease. I hope the information in this session is helpful to you. And if you haven't watched it already, be sure to look at Chapter 15 on tuberculosis. Always be alert that your malaria patient may also have HIV/AIDS and/or TB. Even though HIV/AIDS and TB aren't spread by mosquitoes, the reality is that these diseases can occur at the same time as malaria, and each will severely compound the effect of the other. People suffering from HIV/AIDS and TB need special care when treating their malaria, particularly if they are in the later stages of infection. Until the next chapter, bye for now.